Hello, everybody. Welcome to Friday. I hope you are all as excited that it's Friday as I am. I am very grateful to see the sun shining out there. It brings my positivity level back up, so I'm really grateful for that. It's just me with you today. I have a number of updates, and I'll start as I always do with numbers. So for La Crosse County, we remain at 48 cases. We've not had any new cases come in today. We have 38 who are recovered. We have a total of 4,050 negative test results, and we have 0 hospitalized. So our hospitalized individual was released. So that's wonderful news. And we have 0 deaths for our county. That puts us at the positive to total testing is 1.2% positive. At the state level, we are at 14,396 positive test results. That is an increase from yesterday of 511. We have a total of 172,703 negative tests. That is an increase of 9,465 from yesterday. So we definitely can tell there's more testing happening around the state, which is good news. The hospitalizations is at 2,259, and that is up 41 from yesterday. And our deaths in the state are at 496, and that is an increase of 9 from yesterday. So the state's percentage of positive to total test results in this last day is at 5.1%, but overall for all testing is at 7.7%. That is decreasing, and that's a good sign as well. The National Guard testing site yesterday was very successful. Our preliminary numbers indicate we were able to test about 304 individuals at the site yesterday. There's a lot of testing that's occurring across the state. So Exact Sciences is where those test results get done. And we expect that to come in around the 48-hour mark from the time the test is submitted. So we don't expect to see those test results coming in until probably tomorrow at the earliest. So we'll keep you posted on statistics of numbers of positive tests from the total at the testing site. We have also submitted a second application to the National Guard. We sent that in around noon today. We have a call set up with them on Tuesday, and we'll discuss logistics. So we put in the application and ask for a 2-day testing site, 1 day for symptomatic individuals and 1 day for those that are in response agencies to make sure that we can assess their status. And we anticipate that being around June 7th and 8th. But again, those details will not be finalized until after we speak with the National Guard on Tuesday. And that testing site will be in downtown La Crosse. We have been alerted to a post that has been happening on social media that is about CDC recommendations relating to schools. And you'll see on our social media Facebook page that there are aspects of that post that are not accurate. Specifically in the post, it talks about requirements or mandates for schools, and many of those are not accurate. It is really recommendations, and there are CDC recommendations for schools for the fall, and they will change based upon our community's needs and where we're at the time. So do expect, though, that school sessions in the fall, if and how they happen, will really be a new reality and may look very different than they have in the past. We'll be working closely with the schools to provide the best guidance that fits based upon the data that we have. There also was a number of guidance documents or recommendations released today by the Department of Agriculture, Trade and Consumer Protection, or DATCAP. And those guidance or recommendation materials are relating to farmers markets, pools and water attractions, lodging, restaurants and retail facilities, campgrounds, recreational and educational camps, and veterinary practices. So more will come out about that. I did want to also talk about, we've been sharing on these about move out guidelines. So we know that We continue to have college students in our area that need to move out of their current residences as their leases are ending. So just a reminder that, we continue to have recommendations about that move out process, and have been heavily working to connect with those that are doing the move outs, as well as those that live and may travel through those areas. So just remember, we expect lots of individuals to be in our community for that. And we're also now into the Memorial Day weekend. So there will be we expect to see a lot more individuals in our community over this weekend. We need to be careful and take precautions and try to avoid areas like the college area, which we expect to be heavily populated. We ask again that some of the guidelines around the moving itself is to limit the number of helpers that are coming, to wear the fabric face coverings, and to do everything you can to abide by the physical distancing requirements. Then I want to just recognize that Monday is Memorial Day, and while Memorial Day weekend to many is a time for being with family and celebrating over the weekend, the start of spring, Memorial Day has a very important purpose. And I just want to remember that it is a day to remind us about those who have died in our nation's wars. Those who serve in our military and serve to protect all of us in the United States, including Wisconsin and La Crosse County. And I just want to say thank you to all of those that are serving. And I just appreciate everything that you all do for us. You have heard me talk in the past about how COVID-19 and the response to this virus is something I liken to a war. While it is not, taking up arms and going to other areas like other countries and fighting in that way, it's a different kind of fight. And I do also want to just recognize that there are many people who are helping us fight in this war against this virus. And that includes our National Guard in Wisconsin. And they helped us yesterday immensely by bringing in those testing kits and supporting our community to get tested. We know that testing is a really critical aspect for us to understand more about this virus and what it's doing and where it is in our community. So just many, many thanks to all who are serving. And remembering also on Memorial Day weekend that as we think about this being a time to get away with our families and the guidelines that we've talked about, I just want to repeat them again because, we are looking again at 10 different areas of data that roll up into 3 categories that relate specifically to epidemiology of disease, healthcare capacity, public health capacity, and all of those tell us that we are not yet ready to be widely open. And as we think about travel and all of those other sorts of things that we're doing on Memorial Day weekend, first and foremost, we do not advise for us to be traveling, for us to be congregating. Those are not advised. And we really do need to be very careful. I just want to say that when we think about the guidelines, particularly, again, they relate back to any symptoms at all. You should be staying home. We need to, at every chance we can, minimize close contact with others. We do not advise being with others outside of your household at this time. So minimizing close contact, minimizing travel, especially to areas where there is a lot of virus activity. And again, that is occurring within our state. It is occurring outside of our state borders. And we need to be careful to avoid areas that have a high level of viral activity. The maintaining the 6-foot distances whenever possible, minimizing congregating. I mean, again, we are not advising any congregating at this time, and always wearing fabric face coverings if you do need to be out and about. So, those are hard to remember and hard to think about and follow during a time when we are, trying to enjoy the first part of summer. But the data doesn't doesn't tell a lie, and the data indicates we are not yet ready to be doing more than those guidelines. So I bring you back to those to understand how important they are for us to follow. At this time, I want to let you know that hopefully next week, we're going to be releasing a sort of a visual that will help you see the data that we continue to talk about. We think that giving you access to data to help make good decisions, whether you're a municipal leader or a business owner or just someone trying to lead their family and make sure that you're making good choices, many of you would appreciate having access to the data points that we're looking at, so you can see why we're making the decisions that we're making. And we know that we've heard from many who would find value in that data. So I want to let you know that we are going to have on our website, hopefully next week, and we'll give you more details about this as we get closer. So this is just a heads up for you. We will have something like a compass. So we'll have 4 quadrants within the compass, and there will be an arrow that will point to our current status, and an arrow that points to last week's status. So we'll update the data every week. And as that data updates, again, there are 10 measures that we look at specifically within 3 categories, which I've talked about. And those will roll up into an overall status. And that status will be either severe risk, high risk, moderate risk, or low risk. And so we will be able to show you where we're at, where we were at the week prior. And we'll also have an aligned action guide or a table that will provide specific guidelines for, in a kind of a snapshot format, for whatever sector you're coming from, if it's a business or a long-term care facility. So you'll be able to see what the strongest recommendations are given the status that we're in at the time. So that will help us to be real time in terms of our data and help you see where we're at with that status at each week mark. And we think that that will be helpful and important for you to understand why we're making the guidance, why we're setting the guidance that we're setting, and it will give you information to make decisions that work best for you and your family and business and community. So it really does come back to risk and the risk of disease, the risk of any one of us in this county or surrounding counties being exposed to COVID-19. And that risk level, again, comes from the data. We just heard today that Milwaukee, for example, has had a 30% increase in their hospitalizations relating to COVID-19. So we monitor a lot of things that are happening in our county and across the state and in other counties. We meet weekly with those that work in public health in a tri-state area, including Iowa and Minnesota. So we have, I think, a solid background to provide as best of an evidence-based and context-based recommendation to you when we do these media briefings. And I again urge you to do everything you can, particularly over this holiday weekend, to follow the guidelines in order to reduce the spread of COVID-19 in our community and the deaths that may be associated with it. So many of you are following those guidelines, and I appreciate that, and the health department and community members appreciate that as well. And I just want to say thank you. And I hope that you all will be safe over this holiday weekend. So with that, I will take questions.
Hi, Jen. Declan, Levy, News 19. During the White House briefing today, President Trump said houses of worship need to open. I just want to get your reaction to that and your advice to churches and houses of worship.
Yeah, thank you, Declan. So when we think about churches, I'll just say I'm on a church council for my own church, and we talk about this routinely. When is it safe for those to be in the church? And we are not there yet. The data indicates in La Crosse County that we are not able to do that. We are not able to be congregating in groups. outside of our household. So at this time, my guidance continues to be for our county that we, and surrounding counties really as well, that we continue to be, doing the virtual aspects for worship, as has been the case for many places of worship and churches. So that continues to be the guidance until we see the data indicate differently.
Hi, Jen. This is Tanner Hemker with News 8 Now. So with the 304 individuals being tested and the 400 tests that we have available, is there a reason why we didn't hit the 400? Did just not enough people show up? Or?
Yep. Thank you, Tanner, for that question. So when we looked at the flow of that site, what I understand is that it was very heavy in the beginning of the day. It was pretty steady until about 12:30. Then there was about an hour or so where it was lighter. And then from 2 to 5, it was really steady. And then from 5 until 7, very few cars came through. So it's hard to surmise the reason why we weren't able to get the full 400 tests. When I look at similar lengths of time of testing sites in other areas around us, I am really pleased with the 304 tests we were able to complete. I think it would, if it would have been steady busy the whole time, we would have had no trouble hitting that 400. So I think, it really is about just, 400 people not needing to come to the site. So I hope that that means that there were not additional individuals in the community that had symptoms I hope it doesn't mean that there weren't individuals that had symptoms that, didn't come to the site. I think, though, that there still are, even with a testing site like this, individuals who don't feel comfortable for whatever reason or weren't available. So we never know that we hit all of the individuals in our community that had symptoms that needed to be tested. But it is certainly a significant event to be able to have 304 be tested in our community.
Declan, Levy, News 19. The CDC modified their guidance on how long the virus can live on a surface. Though there is the possibility that coronavirus could be transmitted by touching a surface and then your nose, mouth, or eyes, what's the likelihood that that is lower than person-to-person contact? What would be your guidance?
Yeah, thanks, Declan. I think that this is not surprising to me that the likelihood is lower than direct person-to-person contact. I think we've not really known exactly how contagious those droplets are when they're on a surface. But we always knew that individuals in close contact, particularly if someone is expelling the virus, and the troubling part about that is not knowing if someone, could be asymptomatic or not have symptoms and be spreading. That is a certain a concern. But as far as the viral contamination ability by the droplet on a surface, I'm not surprised by that being lower than the person-to-person contact. I do still think that so we don't have to be overly zealous with cleaning our groceries or stocking up on as many Lysol wipes as possible. I still think it's important to clean surfaces appropriately and to wash our hands and not touch our face. Those are still good guidelines because that is how viruses and bacteria can spread. So even if it isn't as much of a spreading ability for COVID-19, those are still really easy and good behaviors that we should routinely practice.
Declan Levy, News 19 again. With Memorial Day coming up, what can you tell me about camping safety and how that stands?
Yeah, thanks, Declan. Camping is a significant tradition on Memorial Day weekend for many. I think my guidance doesn't change, even though I know many wish that it would. We should not be out and about. We should not be camping But if we do need to be doing that, if you choose to do that, then we would ask you to follow guidelines of staying with your household members, not congregating with others outside your household. We would ask that if you are in common spaces at a campground, for example, that you wear your fabric face covering, because I think that helps protect others, and they should be doing that for you as well. And then also thinking about, don't travel farther than is necessary. So if you are going to camp, and I can't convince you otherwise, there are local campgrounds where it would be better than traveling to an area of this state or other states where there may be higher levels of viral activity. I've said before that my significant concern about bringing virus into the community is about travel, and particularly travel to areas where there is more viral activity. So I think we need to be very careful about that. And I strongly recommend against travel, particularly areas where we're concerned about with that virus levels. And so I think, the other recommendation is that if you are going to go camping, that you get your supplies locally and not wherever you go camping, so that you are minimizing your connections with others outside of our community. So those are some of the recommendations I would provide if I can't convince you to not go camping in the first place.
Jen, we have a question from Facebook specifically about the data when it comes to people that have passed away from COVID-19, and how are the people that are passed away counted? Is it by where they live or?
Okay, sure. So if an individual passes away from COVID-19, and medical examiners, by the way, have guidelines about making that determination of a primary or secondary cause of death, but those deaths are reported by the county in which they live. So if someone works in a different county, it won't be reported where they work. If someone is in a healthcare facility in a different county than where they live, it won't be reported in the area where they seek healthcare services or might have been hospitalized. So it goes back to the county in which they are considered a resident.
Any other questions for Jen today? No questions.
Well, you guys, thanks so much for always being here with me and wanting to be informed and, asking great questions. Just really appreciate that. I know you're all doing the best you can to follow the guidelines. And I think that makes a really big difference for our community. So please stay strong and continue to do that. As soon as we know that the risk level is no longer severe, we'll communicate that to you, as well as what that then will open in terms of the guidance changing. So thank you so much for being here with me, and have a wonderful weekend. Think about those who serve our military, thank them if possible, and do everything you can to keep yourselves and others around you safe. Thank you and have a great weekend.